So if a patient comes in and they have really bad teeth, they've been told maybe at another dentist that all those teeth need to be removed. What's the options for those people? Can't save their teeth. What are the implant options?
If you have old teeth that you can't save, first let me say it's important to get them out from a health perspective, because when you have an infection in your gums, that infection is spreading throughout your body 24 hours a day. That's not good for your heart, and you can research that as much as you want, and you can find that gum infection, tooth infection is closely related to heart disease. So number one, get them out. But here's your options. One is a denture, just a traditional denture, what I call the floaters. Now we do the Fountain of Youth dentures. They're beautiful.
They do look good. I've seen them.
They're going to fit as good as any denture can fit. But a lot of people don't want something that floats around in their mouth, and so they will go with a second option, which is the snap-in teeth. So there are teeth that come in and out, but when they're in, they lock in.
So you can eat whatever you want with these.
That's right. You can eat whatever you want. You can eat a sandwich. You can tear things with your teeth. You can chew, steaks, apples. I mean, you pretty much eat whatever you want with the lock-in teeth. Okay. The third option would be the permanent teeth. These are the options where the teeth they look like real teeth. They feel like real teeth. You brush them like real teeth. You cannot take them out. They are in there permanently. They're beautiful. It's like basically bridges that go across. I really don't even like to call them dentures at that point, because they're not. They're really they're porcelain bridges that go across.
Supported like
there.
4 or 5 implants.
Supported with, exactly, 4 or 5, 6 implants.
And at that point, they could eat whatever they want.
At that point, they can eat whatever they want. Again, it's just like real teeth.
You said they could even work in the circus and hang from the rope.
That's right.
In their mouth.
They could join the circus and be the person that hangs from the rope.
So they're that strong.
They're very strong.
Do you think this is the future of dentistry, that the dentures as we know them today, that means the future, whether it's 50 years, everything will be attached to something?
Yes, I absolutely think down the road. And really, in my practice, this is where we are now. But that all dentures will be attached to something. I think the days of the patch and fix dentistry are numbered at this point. I think baby boomers are starting to realize that they can make one big investment now and get the teeth, those patch and teeth, the patch and fix teeth that they've had over the years that they're having trouble with. They can get those removed and have the permanent teeth put in and be done.
But if you have the bleeding gums, we're talking about the people with really bad gums.
Yes.
These implants are more likely to fall out if you had gum disease?
No, in fact, quite the opposite. Getting the teeth out, putting the implants in is the solution to the gum disease. They're no more likely to fail if they had prior gum disease. That's another misconception people have. They say,
so you clean up the gums.
Oh, we clean up the gums. The gum disease is eradicated when the teeth are removed. People think, well, it's hereditary. My parents had it, my grandparents had it, so I have it, therefore I shouldn't get implants because I don't want gum disease to get on the implants. It doesn't work that way. When we remove the teeth and put the implants in, there's no history of gum disease at that point on the implants, and so the implants will last. I think the success rates nowadays are 98, 99% success rate on these, and these are lifetime, long-term success rates. So very successful, much more predictable than if someone was to go in. Again, these are the people that have bad teeth.
Yeah.
Much more predictable than the patch and fix dentistry that they've been doing for the last, however many decades.